Hello, everyone, and welcome back to the Empowera podcast. This is episode 21. This is season 3. So excited. What is Empowera? If this is your first time here, Empowera is a podcast run by healthcare professionals for healthcare professionals and the general community with an overall goal of raising transparency and awareness, with a continuing goal to have legislation passed in the state of Colorado and throughout the whole United States mandating employer wellness programs. That includes so far 3 things, which is first, a minimum of 2 wellness days granted per healthcare professional per quarter. That is fully backed by the employer. Second is the uploading of funds per quarter onto an HSA account for healthcare professionals that is tax exempt at the federal, state, and local levels. And third is the establishment of a retaliation department that is run by a third party, in which members of the healthcare team can go and voice their concerns without fear of retaliation. At Empowera, we believe in the power of community, diversity, and inclusivity to create positive change and help improve society if we can. Our podcast aims to amplify voices that often go unheard, featuring interviews with individuals and organizations who are making a difference in their community and beyond. Through thought-provoking conversations, shocking revelations, and even inspiring stories, we strive to continue to raise that transparency and promote action towards a more equitable and sustainable healthcare realm. All right, we have our guest today. Our guest is, who are you?
My name is LaKesha, and I'm an RN, and I usually work in California.
Say that one more time. You usually work? California. All right. Well, Air 5 all the way. I'm currently in Ohio at the time, so thank you, LaKesha. Before we go any more forward, if you have not hit that subscribe button or the bell icon to receive these up-to-date episodes, please do that. We'd like to be able to have what is truly happening at the forefront here in healthcare. All right, everyone. So sit back, be yourself no matter what, and get ready to be empowered. All right, LaKesha, this is the part of the show where we give a big community thank you to not only members of the healthcare team, but those all throughout that do their part. We know who they are. They're number one. If you'd like to give any special shout-outs, you're more than welcome to.
Thank you, everyone, for being a part of our community and just taking care of everyone and taking care of yourselves as well.
Yes, thank you, definitely. And it's something that can happen on the day. It's like those acknowledgments really can make a difference. So, LaKesha, if you could tell us a little bit about what kind of brought you into healthcare, and what you said you worked as a nurse, if you want to include your specialty, that'd be great too. If not, totally, whatever it is.
When I was in college, I was actually pre-law. And prior to going to college, in high school, I did that assessment test that told me I should be a caregiver because I was always taking care of people. So after graduating college, I was like, well, I don't want to do pre-law. I guess I am going to do that health assessment advisement and go into nursing and help people, since I do have a passion just for helping others. Wow. So I started as a nurse assistant. Mm-hmm. And while being a nurse assistant, I was like, I definitely need to get my RN because...
Sharing that you did the test for college, found out, not pre-law, and then that was where I think we were at. What brought you into healthcare? We were there. And then what part of the healthcare field do you work in? That's where we were at. Okay.
Okay, so I currently do intensive care unit per diem, and I work full-time in a psych unit right now at the Traveler.
Wow. And that's one of the first people I've had that wanted and has declared that on the show. So thank you for what it is you're doing. This is actually the part where I ask myself, Brett, does this guest truly make you feel empowered? And yes, LaKesha, you certainly make me feel empowered, especially stating that area of healthcare, because it takes a specific person, a specific loving, compassionate caregiver to be able to care for that population. And believe it or not, they're everywhere. Doesn't matter. And for all those new grads that may be listening too, they're everywhere. Doesn't matter where you go. It's just there can be intensive, like any other diagnosis or whatever, right? I mean, varying degrees. Those who need more intensive care. That's it. Wow.
Right. Yeah, with the psychiatric facilities, We get a lot of patients who are a danger to themselves, a danger to others, or greatly disabled. So those three main categories.
Wow.
Or detox.
Mm-hmm. I was going to say, I know it's interesting to see, like, I call it the hybridization that's kind of going on where it comes to, like, what patients can go into what units. Like, I know I was working dementia and memory care, and we had a patient that came, legitimately had their hip replaced, had staples. They were literally back in the dementia unit with staples. The incision was well approximated. Like, it was good. It wasn't open whatsoever, but, like, it was interesting just to see that. I usually think rehab unit or, something else, but no, they were there. So, wow. All right, next question. This is the juice. This is what people like to hear. So, and no problem here, because this is the Empower podcast where no matter what comes out, we bring you back and empower you back. So, LaKesha, what, in your opinion, is happening in healthcare?
In my opinion, I'm going to talk about the bad that's happening in healthcare. Mm-hmm. And right now, I think there's just a lot of disgruntled employees and staff, and there's a lot of disrespect that's happening in the field. I don't think nurses or nurse assistants are being treated very well. Like, somehow kindness and fairness just went away, and that needs to come back. And that's a big reason why people don't want to stay in healthcare. We're not treated well. And I kind of tell people it's kind of like the movie Pretty Woman. Now I'm kind of in my mid-30s, so like a lot of generations cannot relate to Pretty Woman. They don't even know the movie. Mm-hmm. On the film, there's a woman, and she's an escort / hooker, and she's treated really well by a high-paying client. He treats her with respect, and his friend sees her. He wants to treat her any kind of way he wants because he's paying her. And that's kind of what it's like to be a traveler in the field right now. You have people who will respect you, and then other ones who just want to disrespect you and treat you any kind of way because they're paying you. And that's not how it should be. Mm. Like, yes, we come to work and we come to help, and we come to work within our scope of practice, but a lot of people just feel like they can do whatever they want, give you the worst assignments every single shift, and just treat you like crap. So it's hard to go to work every day and be treated like crap.
In addition to being a healthcare professional, right? Because, I mean, that's a real distinction. If I can add, I know on my last assignment, I mentioned it before, but on my last assignment, you're up to something, LaKesha. And the thing you're up to is there's this distinction, or I want to say it, I declared it as a discrimination on the floor between traveler and staff. When we all have this common goal, improving the patient's quality of life and experience. And when I was there, I did, and it's on my resume now. That team building, because that's what that is. It's a lack of integrity in team building, and we all have the same degree. We've sat down and take the same test. You may have licensures and certifications. Great, they can all fart that out. That's great, and it's not a bad thing. That's still work to be there. But some people who still have their BSN want to make it seem like their BSN is better than anybody else's, and it comes down not only on the floor but down to even this distinction that we're talking about of traveler versus staff. When really it's nurse, it's environmental, it's speech therapy. That's what it is, in my opinion. It's not traveler versus staff. And I spoke up not once but twice on the floor, and the mildest initiative that happened was they got a map up on the floor. And travelers could, no matter what discipline, put on the map where they were from to help build that camaraderie, to help build that rapport, to help. And in the end, it's not about us. And it becomes about us. I feel it's about the patient experience. And it has
I find myself doing exactly what you're saying. Mm-hmm. There is that being a traveler and having to initiate team building and collaboration between staff by letting them know your story and where you're from and why you became a traveler. Because a lot of people do express the jealousy of travelers for making more money, when like the reality of the situation is that they're angry at their higher management for not paying them more. It's like, I don't choose your paycheck, and I was staff just like you were staff, and I had travelers, and we never treated our travelers like crap. And if you want to travel and make more money like me, you can, but realistically, you're the one who's actually winning. You get retirement and benefits. I don't get any of that stuff. Yeah. I'm winning short term. You're winning long term.
Wow. Right, and there's some programs that are kind of coming out, but yeah, wow. That's true. And the other part is, check this out. And I didn't even get to tell you this before our pre-recording here, but I, like 2 days ago, call up a past employer because I'm back in Ohio. I've been working with them off and on since I had my first job at the Cleveland Clinic, and then I found out the ED was not for me. That's what happened. But I hit them up, and the rate over time of how much they paid me from new grad until now, I legitimately went through and I called up an agency that I was using in Colorado, and their rates here in Ohio, that agency, are half what this PRN staff nurse position is at a place that I've been going to that's like privately owned. And it's interesting to see that distinction because it was the reverse during COVID, and now there's this.
Right.
I'm watching rates, and I know I'm not the only healthcare professional watching them, and they're crap. I want to declare that on here. They're crap, and I'm not gonna. I feel degraded. I feel as if my work ethic is not what it is I want to put in for that, especially when it comes to squeezing all the juice out of the lemon and then expecting all these other duties to be applied for a traveler or whatnot. Like, learning policy and charting is already a challenge. I mean, I even feel like the charting software has gone, like the actual training for that has gone by the wayside. And a lot of training on the job regardless for that. And the overall impact that has on the patient experience and on even a potential transition of, and this happens, is the transition of traveler or agency to staff. And they can show that. That's like a prequel. Like, what is this employer even doing for whoever now? Do I even want to like look into potentially investing like they did years ago? And it's not the way I feel like things are now, is 20, 30, 40 years of my life into this company, you know? And we're having that own distinction. And I feel we're all wanting to become more free agents in a way because there's no continuity or, and I've heard it before too, respect or admiration for hard work now. There's no like incentive for that.
Right.
And it makes a total difference. Not to say that like, and that's, I guess I'm having a real distinction conversation here because I do want to get back to what it is your answer is, but I feel like this is just a topic of what is truly happening in healthcare, and it adds into what it is you're initially talking about, is this literal like double standard of or a difference in overall, I guess, integrity of treatment from staff towards travelers, the best way I can say it, because they are still technically representing that company. They're still carrying out the mission statement, hopefully, if they said, yes, I want to work for this employer, of that company. And as a traveler or an agency, you take that on, you know? And it's
there is a huge shift, like you said. Like, over the past 6 months, I've definitely seen a drastic decrease in rates for travel assignments. So more people are staying home and taking those per diem assignments instead.
And the industry knows. And the smart ones are the ones that are already throwing in and like saying, great, like we want you on board. We totally, even if it's PRN.
Yeah. And they do treat you a bit better as a per diem. And sometimes like I've even gone per diem through registries such as CareLab. And you're still treated a bit better compared to being a traveler.
Yeah.
Even though you're not a full-time staff member.
And that's already in addition to what's pre-existing for humanity. All these other forms of double standards and discriminations, like, we're just tacking it on. Let's just throw it on the wagon, keep going. No. Now we know. I think more in society, we know it's been on the wagon, or we know, wow, this is too heavy. We don't want to carry this weight anymore. Let's disappear this upset, hopefully, and recreate or downsize on that. As the employers are already doing the same thing financially. So... It's wow, I don't know. It's quite something.
I mean, something good did come out of the pandemic, and it is the fact that more people did stop working for the hospitals and that they did get up and start traveling, because that is forcing hospitals to give staff more raises.
You're right.
So people might be mad at the travelers, but these travelers are to help you get a raise that you would have never gotten.
Yeah, why not work in tandem with them? You know, have them literally, even though they're there for that assignment, see if they can help you with quality initiatives. Mention them, because I don't get any of that mentioned from management. It's mainly well, this happened, let's restore integrity because of this. And then there's also, and I'm declaring this one, there's absent management when you're a traveler. Somehow, I know, I worked with a CNA. I started around the same time she did, she started a month before me. And I asked her, because I only got to see that floor manager on my last assignment one time. Only saw her in person one time. Yeah, this CNA who's a staffer never met her. Never met her at all. Like, And that has an impact. I want to know who it is I'm working for. Somebody I can go to talk, somebody I can, that's what a manager is there for. Hopefully they have that, what's called open door policy, and not, in my opinion, absent or locked door policy. That.
Like you said, a lot of places, they don't even have the management. They're putting new grads. You know how new grads don't have the flexibility to leave, so they're the only ones that are regular full-time staff. So there's a lot of new grads who are temporarily filling the roles of management.
Mm-hmm. And it has a high turnover rate. And for those who don't know, they're just like, this is a quick way to, maybe climb. It has like almost to climb the corporate ladder that way. When honestly, look at the statistics. I mean, and don't get me wrong, it can be done great too. I had a past guest on here, probably one of the best DONs I could think of for the position that she's at. And she's worked her way up from staff to DON. I mean, she's done the work, and she takes that initiative to really step out and speak up for not only staff but the patients, even if it's in the face of disagreement. And I agree with you. Like with a new grad, they're so just getting into stuff, or someone who's new into the position, that it's literally the blind leading the blind almost if they're asking for help. Yeah. And it's not to mention, here's the thing I'm finding out too, is through employee wellness programs, we could ease that. Let's find a way to recreate that overall hierarchy that they want us to follow as employees, but let's actually see initiative. Let's not just know the knowledge that this hierarchy exists and that what they do. Let's see the action. That real distinction of that makes a total difference. Not just a chocolate bar around November or December for night shift nurses, and it's one chocolate bar for eight nurses, like, and CNAs, like, legitimately that shows that. I mean, even if it is a physical object or gift, even just time and presence and being there is to know that there could be a difference that can be made. Or these are things that are currently things that have come up on the floor, like for even traveler and staff, So, and then even potentially, if we still are having this hybrid environment, have counsel. Allow for that. We don't have to call it a union. Matter of fact, what do they call it now? There's a term for it. Oh gosh, hold on. It's slipping me. It's just a generalized term, so it's not like union. I can't remember what it is, and it does have its own distinction. But it is like a form of like counsel or whatnot. Yeah, but it's almost like a sort of feedback. But I think as I live life as a wall of knobs, we could probably turn up the knob in that. At least have the admiration that the knob is low. Let's turn it up, and see what happens.
Right.
Yeah, but wow. Is there anything you'd like to add as to what is happening in healthcare? Because I'd love to have you back on, too. A lot of these, sometimes with guests, they're like, oh, there's so much. And there is. I agree. That's why I have this. But
it's just like, they got to be fair with your travelers. You should just treat them like they're staff instead of saying, oh, traveler this, we had to have different color badges or no badge at all. Or you get a badge with just your name and no picture. But if you treat your travelers like staff and don't make that distinguish, you don't have to distinguish it to everybody.
Mm-hmm.
You can distinguish it on the schedule for scheduling purposes, but just say my staff, not this traveler this traveler that. Don't give your traveler the worst assignment every single day. Like, what people don't understand is, travelers make more money because on their contracts they're also forced to work more hours. During the pandemic, I was forced to work 6 out of 7 days a week. So, yes, I made more money because I had to literally work 6 12-hour shifts a week.
Wow.
And that's something I had never done before.
Yeah.
I never worked 6 days in a row, ever. 12-hour shifts nonetheless. That had never happened until the pandemic.
Yeah, and I feel like then the industry got used to that, and they're still shilling out those offers for 4 to 6 shifts a week, but then they've, cut it, They've cut the overall offers, and they're, expecting the same amount of work for less pay, and it's okay, well,
they're trying to make people do 48 hours, but it hasn't been successful. People are burnt out.
Yeah, we all want the original, I feel, the 312. Let's have some 312s, and if we can get a block schedule to increase not only continuity of care and help with continuity of care, but improve the patient experience through that, and I've seen a difference in my overall, if I had to do a self-assessment, my overall interaction of when I was a traveler and staff, I think continuity of care made a difference for me. Being able to have the other potential stressors on the job. Yeah.
And somehow that goes out the door if you're a traveler. They feel like your patients don't deserve continuity of care.
Or you have this adaptability to be able to be thrown elsewhere, but the patient's still keeping count too. I've had ones. Are you back tomorrow night? Am I going to have you again?
Mm-hmm.
That still comes out.
Are you my nurse? Are you going to take care of me? Why aren't you taking care of me today?
Yeah.
Did I do something?
Or the other nurse.
No, it's not you.
The other nurse is told, the CNA is told, why isn't so-and-so back? Like, that comes out too. Like, that,
yeah.
You know, hospitals want feedback. That's micro feedback right there. Why aren't you guys picking up on that? You know, that's a pretty big one. That makes a total that's literal liquid gold from the mouth of your patients and their brain. Like, come on. I guess so. Knowing what it is you know now so far with healthcare, are you looking to continue to give back and stay in that certain area of healthcare?
I don't plan on being bedside anymore. I'm definitely over bedside. I actually start my psychiatric NP next month.
Congratulations.
But a lot of times with doing the bedside, thank you. You don't get the help that you need. Patients, we have a very obese population compared to ever before. And if you're fortunate enough to work at a hospital with a lift team, you get more assistance with turning patients, but that's something hospitals have to definitely improve on. Like they obviously want to talk about proper body mechanics, but sometimes you just still need more assistance when your patient is unable to care for themselves and it's not provided.
Wow. And then I guess, and thank you for sharing that, what would be like, I guess, some empowering pieces of advice for people looking to go into, I guess, ICU or you had mentioned working mental health at this time, or any of the line of work that you've worked, LaKesha? I guess any questions to kind of ask prior to employment, things to look for on the job nowadays, to keep that passion that you have. I can hear it.
I would definitely say if you're going to go into something like the ICU or even a med-surg position, like look at a facility and look at what they invest in equipment for their employees. Like not every facility has a lift team, but I would definitely choose a facility that has a lift team versus one that doesn't have a lift team. Or I would look at to a facility that has the proper equipment for no lifting at all, where they have proper equipment like ceiling mounts that help come down so that you can turn the patient by putting proper equipment on them. Because you only get one back for your life. And
yeah, you're right. And the beds can only tilt so much and whatnot. I'm glad thank you for declaring this on the podcast, because being a male in nursing too, I'm going to declare this. I've been called a lot more. Hey, Brett, can you help pull up this patient in bed? Hey, Brett, can you help pull up? Yeah, sure. But it is predominantly because I'm a man, and I'll declare it. But at the same time, too, I've also worked with a CNA who was like half my height, and that lady had more oomph than I did at that time. Like, I've seen it. So it's circumstantial. But, yeah, you're calling that, it's actually called a lift team. I've never heard this term.
Yeah, they have a lift team where they'll have 2 or 3 strong people come by and turn the patient for you in the ICU. They'll either turn them for you or they'll assist you with turning, but, like, just having that whole team assist with it so it's not all on one person. Wow.
That is revolutionary. I love this. I may have to go back on and have a little podcast to talk about this. It's mainly in the ICU from what it sounds like, but I just imagine that integration anywhere, especially even mental health.
I've been across the country, and it seems like a California thing so far.
Okay. Wow.
California does invest in more for their staff. Better ratios, better work environments.
Right.
I haven't seen it anywhere else.
Actual legislation for it, yeah.
Right.
Oregon, and that's one of the benefits. I have to say, there's not all bad that was in my assignment, but like that was one of the benefits I did have, especially being burnout and continuing to work. And I'll declare I did that. But was that ability to have those mandated breaks and to have your resource nurse or your meal and break nurse to be able to do that, and also to allow sometimes when burnout occurs for those to speak up and ask your supervisor, hey, or your charge nurse, hey, can I do meal and break this time? And then not have somebody who hogs it all the time, but that distribution can even help out too, Because and the overall ability is
having a break nurse. Don't give me somebody who's lazy and not going to help.
Yeah, seriously.
Give me somebody who's going to be useful.
Yeah, someone that will take a list down when you're on your lunch if you have something to do, or an IV bag that needs changed over, like even if it's something minimal. And it could even be presence and listening, because sometimes we don't have that ability so far. And I had a guest on. It turns out her mother even went to nursing school and graduated in 1924. So like nurse to nurse. Wow. Like I love to interview. Her name was Linda. But she had talked of how much healing can really occur with listening and having that ability to just listen and be present. And a meal and break nurse can do that kind of a thing while other nurse is doing something else in another room, Like I said earlier too, like we all have a similar degree, So like we all have the same degree. It's just, legitimately, if this person needs chemo, okay, cool, certificate, got it. Like, okay, like critical care certification, okay, got it. But listening, presence, I think that can even extend all the way down to environmental. Some of my most innovative moments I've ever had have been with those who don't have a degree. So, and I think some of the best ideas for wanting to give back, but wow. Okay, so having answered all of this and being a part of this was an exciting interview. I really appreciate it, LaKesha. Like I said, love to have you back. This is the part where we're definitely, is there anything else you'd like to add at this time first?
For people considering working in psychiatric, make sure you're working in a safe facility, because this facility I'm currently at is probably the least safe facility I've ever worked in my life. They told me it was a safe, secured unit. My background is in corrections, where I worked for 4 years with the state of California, and I never felt like I was unsafe. Like, I knew there were always correctional officers around, always had my alarm on me. They were either within eye shot away, or when I pressed the alarm, I knew like they would be there immediately when I needed them. This current facility I work at, I didn't even know places like this could even run in California. They said they had trained security, and they don't. Just people who literally have a guard card and have no patient experience at all, no physical hands-on at all. And at this facility, they expect nursing staff, they expect all staff to go hands-on if the patient gets wild. I'm like, they didn't tell me that expectation before hiring me.
Yeah.
And while on orientation, I had to help with hands-on. I was like, this is crazy. Like, nobody's trained to do this.
Yeah.
So
wow.
Just make sure it's actually a safe place and that they actually have trained security and things like that.
Yeah. DYOR. Do your own research even on site. Yeah. Wow. Because, you're right. People, like, they say one thing and then do another in today's world. And it sounds like the moment when you draw the curtain back, or you take whatever's technically being set up in the stands, and it may be someone's feedback or whatever, and you put it on the court, things can happen, especially even like that. So I appreciate you even saying that on the show, because it's like almost like within healthcare too, like there's corners that are being cut just strategically, just enough, and it's based upon past research, in my opinion. I mean, I'll never forget when I worked at Arby's, and I know I'm not shilling out Arby's here, but that's just where I worked. It's my first job. Like, they legitimately, down to the hour, would be able to compare and know supply, how much return, and this was all based upon past years of research, and those words are called projections. And I've noticed when I ask insurance or anybody else that I interact with, ask them about their projections, because I guarantee you they have them. They're probably flawed up because of COVID, but they have projections from 10, 20, 30 years prior as to what, these things are out there. And it's amazing that even insurance companies and other healthcare systems, that they have this data, even with the use of AI and IBM and whatnot, and being able to, it's quite a distinction to be able to share that with the public and have it, like anything, like knowledge can be used for good or for evil, but at the same time too, I feel in today's world, it's a lot less, it's more difficult to try to hide whatever it may be, to be manipulated, it's a lot more transparent. And if it is, the people who are trying to do it, they're very good at what it is they do, but like anything, all things must pass. So
I guess to go with what you're saying, like, a lot of companies are manipulative with trying to get you hired and working for them. So a good thing to check would be look at the length of employment that people are actually staying. See how long the CNO and the CEOs are actually staying on board. Because the company I currently work for, they've had 5 CNOs in the past 2 years. That says a lot.
Whoa.
So you can see a lot about the stability and the work environment based off how long people stay. A good place people stay.
Yeah. Wow. All right. We are about to close out here. And LaKesha, thank you once again. If you can go ahead and tell us, what is your empowering quote for our listeners to bring them back here? Because we did relay what happened in healthcare, so here we go.
I think it would be a combination of 2 popular quotes. Treat other people how they would, treat other people how you would like to be treated, but also treat other people how they would like to be treated. A combination of those 2.
I love it. No, it's a daily, it's an hourly thing, it's a minute thing. It can be totally circumstantial in that moment, right? To treat others the way you want to be treated, because there's other variables and things that are going on in healthcare, and wow. to revisit that thought is thank you for that.
You're welcome. Pleasure chatting with you.
Definitely. It's good. Love to have you back. All right, everyone. This was season 3, episode 3 with LaKesha. Thank you so much. And we're signing off. Bye for now. Wow. I love it. All right, folks. So this was episode 22 with Crypto Matt. Thank you all for being here, and we're signing off for now. Bye for now.